As hardworking Alabamians, we always want the best for our families and our communities. There is one measure of success that makes it all possible: guarding our collective health.
We know that a healthy Alabama is a productive and prosperous Alabama.
Public health touches literally everything. We are responsible for making sure that citizens of Alabama are receiving the care that they deserve.
Many times people want to treat an individual after the fact. Part of our work really is focusing on prevention, achieved across all the spheres of influence on the social ecological model. We want to meet the individual needs, but we also want to create that environment that is supporting healthier choices.
We have a very determined and individualistic state, and we need to come together to say we need to make a difference.
Us men, we often don't go see a doctor when we need to go see a doctor, or we don't get the checkups that we need, the annual checkups. We don't exercise. Preventative medicine is key to a healthy Alabama, and that includes regular checkups, keeping your immunizations up.
If you're a smoker, you need to stop. If you're overweight, you need to work on that, and I know that's easier said than done.
Eating right, exercise, getting a good night's sleep, following up with your physician.
We really have to be thinking about everyone in Alabama, not just able-bodied citizens, not just people that are likely to have, access to resources, to emergency resources.
Healthy children are the future of us as a society, so we need to make sure we are protecting and supporting our mothers, because they're the future of our children and the future of our state. We need to make sure that our children are covered by insurance, that they get preventive medical care, that they have healthy and productive lives and grow up to be productive adults. Respiratory illnesses are unavoidable in childhood, but there are some things that parents can do. Vaccinations can be important for those that we have vaccines for, like flu and COVID, but also teaching children about respiratory hygiene. Things like coughing into your elbow, keeping your hands clean, trying not to touch your face.
We're very data-driven. Our decisions, our approaches are all based on the data, and hopefully what we do and our efforts will show in our data in the future. There are a lot of diseases that are preventable with vaccines.
Folks that had healthier lifestyles had fewer complications from COVID.
People who had uncontrolled disease, obesity, diabetes, they were at risk, because when anything comes that's an insult or a pandemic-type situation, you want to decrease your vulnerability by trying to be in the ultimate health that you can be.
Our work, to us, has always been very important, but we began to realize just how important it was as a defense against complications.
Being an Alabamian, being someone who's been in Alabama all but 6.5 years of my 46 years, I feel very strongly that I am tied to this state and I'm tied to the health of the state, and I want this state to succeed.
We want to encourage people to make informed decisions, but also give them the tools on which to do that.
Success at every corner depends on the health of the people involved. Our civic leaders, teachers, students, parents, volunteers, first responders, and so many others. A healthy you is a healthy Alabama.